Have you ever wondered about the intricacies of COVID-19, the disease that has dominated headlines and altered the course of our lives for the past few years? Today, we delve deep into understanding the symptoms, causes, diagnosis, treatment, and preventive measures associated with this global health crisis. COVID-19, first identified in Wuhan, China in late 2019, primarily affects the respiratory system. It can, however, have systemic effects ranging from mild symptoms to severe respiratory distress and multi-organ failure. The common symptoms of COVID-19 include fever, cough, and shortness of breath, which typically present within 2 to 14 days after exposure to the virus. Additional symptoms may include fatigue, body aches, loss of taste or smell, sore throat, and gastrointestinal symptoms like nausea or diarrhea. The severity of these symptoms varies widely, with some individuals remaining asymptomatic, while others may develop severe respiratory complications requiring hospitalization. The cause of this global pandemic is a novel coronavirus, SARS-CoV-2, believed to have originated in bats. It is transmitted to humans through direct or indirect contact with respiratory droplets from infected individuals. The virus primarily spreads through respiratory droplets expelled during coughing, sneezing, or talking. It can also spread by touching surfaces contaminated with the virus and then touching the face. Airborne transmission may occur in certain settings, particularly in enclosed spaces with poor ventilation, where the virus may linger in the air for an extended period. Diagnosing COVID-19 involves several methods. The gold standard for diagnosing COVID-19 is polymerase chain reaction (PCR) testing, which detects the genetic material of the virus. Antigen tests identify specific proteins on the virus's surface, while serological tests detect antibodies produced in response to the virus, indicating past infection. Imaging studies like chest X-rays and CT scans may reveal characteristic lung changes associated with COVID-19, aiding in diagnosis and assessing the severity of respiratory involvement. When it comes to treatment, individuals with mild symptoms are often advised to isolate at home, rest, stay hydrated, and manage symptoms with over-the-counter medications. Severe cases, particularly those with respiratory distress, may require hospitalization for oxygen therapy, mechanical ventilation, and supportive care. Antiviral drugs like remdesivir have been authorized for the treatment of severe COVID-19 cases, aiming to reduce the duration of illness and improve outcomes. In summary, COVID-19, a disease caused by the SARS-CoV-2 virus, presents with a range of symptoms and is primarily transmitted through respiratory droplets. Diagnosis involves PCR testing, antigen tests, serological tests, and imaging studies, while treatment ranges from home care for mild cases to hospitalization and antiviral medication for severe cases. Understanding these facets of COVID-19 is crucial in managing this global health crisis. Stay informed, stay safe.